Good evening, good morning, good afternoon, everyone, wherever you're joining from. I'd like to welcome you to our Pathways in Medicine Part 2 series for this year. And we have a very special guest in our midst. She's no other than Dr. Bilkis Oladimeji. And I would like to just say a few things about her. She is an experienced physician and health informatics professional with more than 10 years experience across clinical practice, clinical research, genomics, and personalized medicine. She is working with United Health Models and Advanced Analytics, and she's also in charge of areas of STEAM, innovation, diversity, equity, inclusion, and maternal health. She currently serves on the board of the Engineering World Health, which is a non-for-profit that supports biomedical engineering careers. She has co-authored several books, including a global textbook on informatics that was published last year, and she is a frequent speaker at several international and national workshops and conferences. So with these few things I've said about her, and there are plenty achievements attributed to her. I would like to welcome Dr. Bilkis to the session today, and she's going to take us on Chart Your Path with a Mission Journey Through Medicine and Health Informatics. So Dr. Bilkis, you're welcome. You're muted. Yeah.
Okay. Thank you so much for that graceful introduction. I'm just delighted to be here today and to be able to share some of my journey with everyone that's on the call. Thank you, everyone, for joining this session as well. I could have just titled this Journey Through Medicine and Health Informatics, but I think at the core of who I am and the different work that I do is the mission that ties all of this together, which is why I chose the either of Chart Your Path with a mission. And I'm just so glad to be able to share that journey with you. There's so much that can be covered in in some minutes here, but I will do my best to sort of introduce you to who I am, what I've been able to do so far in the field of informatics, help you see some definitions around health informatics, what it means, the types of things that you could do with such a profession or such a career. And I hope that this is not a one-off conversation, that we can continue these discussions even after this presentation. So without additional thoughts, I'm just going to go ahead and begin the presentation today. So first of all, I want to know from the audience, do you have a personal mission? You can type yes or no or thereabout into the chat today. Awesome. I see some entries already, and I won't be able to man the chat as much, but still, I'm grateful for your responses so far. I wouldn't ask you to put it in here if you do have a personal mission, but it's good to know that some individuals have that personal mission, because it's at the background of a lot of what you will be able to accomplish, or even the things that you'd be able to do. Also, if you don't already, it's an opportunity for you to do so. And I think a personal mission always comes from self-awareness, which is deeply tied to reflection and assessment of self, and just making sure that you continue to think about yourself, your past experiences, your dreams and what you want to accomplish over time. So things like self-awareness, North Star, core values, your core values and principles, your definition, your own definition of success, your goals, and the impacts and contributions you plan to make in the world all have a part to play in what your personal mission is. And when you have that person familiar with Stephen Harcovey, and you will, there's a quote by him that it's better to live your life by a compass and not by a clock. Even though both are very important, you know, you want to get to do the right things at the right time, but being on the right path and being on such a journey that is focused can make a huge difference between what you are able to accomplish and what you're able to do, such that even if you don't get to it at some particular time, you can always get back to it because your direction is not lost. There was something I came across earlier today as well as one of us this morning, and it reminded me of a Toastmasters presentation that I made. In Yoruba land, there is a saying that Kia kutoka tun ara eni bi, and that really means that rebirth of yourself. You know, there's the first birth of you that you don't have any control over, but as you grow older, you have the opportunity to sort of reborn yourself. And a personal mission can help you drive and get to that as best as possible. A lot of times when I want to talk about my journey, I like to show these two pictures. The first one that I'm hovering over right here is a place in Isolo in Lagos. It's a small town called Ishagatedo, and that's where from the ages of 9 up to the time that I graduated from medical school, which is the second picture that you see here, that was where I grew up. And I usually show this because there is always this thing about where you're from, sometimes determining how far you can go. But I can tell you that with a different type of mindset, with encouragement, and with personal conviction around what your dreams are, what your success story or what you want to accomplish, it's be birth yourself, like I mentioned earlier, and to be able to make the right decisions for yourself. This picture of me graduating medical school always brings back a lot of that time, at that point in time, different dreams that I had, a whole lot of personal decision. I'm also someone of faith, and a lot of faith went into being able to go from what I'll call a local champion that came out of this environment to become a medical student at the University of Lagos, and then graduating from the School of Medicine. One of the things that has helped with my self-awareness have been books. Even at the time when I was living in that neighborhood, I always have this opportunity to sort of get back into myself. And how I do that is my escape into different books, whether it's science books, whether it's, you know, faith books, whether it's psychology books or about. That always was something that was a grounded dreamer, and he would be right to call me that, because as much as I dream and have my head, you know, in the clouds, trying to figure out what is the next innovative thing or what is the next opportunity that's out there, I remain grounded in a lot of the core values and the reality of what's going on currently. And that, I think, has enabled me to be able to tie those two parts together in a good way to be able to accomplish some of what I have so far. And sort of like, I don't know how many of you on the call are familiar with Moana. how she was always looking forward to what's beyond the horizon and trying to get out of that island. That was pretty much me. I didn't see myself being defined by where I came from. So like I was saying earlier, some of the books that have shaped me have been around self-awareness book and books that help you define your purpose. Some of them include, of course, the Quran, which is my faith book and teaching. The Fulfill Your Soul's Purpose, which is a book by Naomi Stephan. And it recognized me very quickly as someone who is a motivator doer. So when you know yourself as such, you're able to be able to do a lot more for yourself and for those around you. The other one is Gary Zukav's book, which I read in college, which is called The Seat of the Soul. So I've always been very obsessed, if you will, with mission and purposeful engagement. And that included things like trying to volunteer to just make the world a better place in the little capacity that I might have. The other thing is the spark of curiosity as well that comes along with it, which I'm truly grateful for because it's helped me sort of look beyond where I am currently in different discussions. So I put a few examples here. As I was preparing for this session, I came across a presentation that I gave to some high school students some time ago, and I coded my mission in 2019 as follows: solving healthcare challenges with evidence from data and utilizing innovative technology to achieve the quadruple aim increasing the quality of care, making sure that patients get the right satisfaction, making sure providers get the right satisfaction and joy of work. And then the fifth one is all about equity, which some of you might also be familiar with. In 2023, I think it has evolved to being just helping humans reach their full potential through my three things, which are education, health, and equity. And those three things I think are very core to sustaining humankind over time. So your mission can evolve, and please allow it to evolve. Now, diving back to the topic of health informatics itself, how many people in the audience have heard of health informatics prior to this? I don't know if you can use a show of hand or something. So again, whether or not you've heard about health informatics, I'm going to give a little bit of a primer of what it is and talk about some of the work that I've done in informatics after making the switch from clinical medicine practice. So first, it's my own journey in health informatics. The first time I heard about health informatics was, again, driven by curiosity. I had attended a session from that was organized by one of my colleagues at school. I am one of those individuals that like to participate fully in what medical school was. So the opportunities for leadership, opportunity for politics, opportunities for volunteering, all of those things I would do. And sometimes you'll find me in between classes running to one event or the other, whether it's about quality of health, whether it's about climate, and so on and so forth. So I saw this banner or a little flyer for this event called other careers in medicine, just like what what we're looking at today. And I was really curious about what that is. It was in that particular session that I first heard about. That was in 2009, just a year before I left medical school. And I listened to this person talk about the amazing things that can be done with health informatics in healthcare. And I, as a medical student then, I was always thinking about, the situation that we have, the lack, especially around infrastructure and several other things that are wrong with the healthcare system in Nigeria. Not to say, like, again, one of the reasons why healthcare informatics is still very relevant today across different parts of the world is that every health system has their own challenges, some of them similar to others, some of them very peculiar to the different countries. So not by any means a rub down on Nigeria and its health system. But as a survivor of the system myself, I know how hard it could be to actually practice medicine. There's always a challenge between what you know and what you're able to do within the environments that we do it. So this curiosity about what this event was about led me into knowing about health informatics and knowing about several others like sports medicine and how you can get into those different areas as well. Following the discussion, I summoned the courage to walk up to the speaker, and I requested to sort of follow up with them and have a conversation with them. And we set up some time, had a discussion with them. I think I had to go to Ikeja or something from Luton just to meet this person. And they ended up being someone like a mentor to me. And so that was my first internship in health informatics. And this person took me through some of the rudimentary of the profession and what they did at the time. And at the time, they were also looking to bring some electronic medical records into Nigeria. And so I helped to pull data, made some requests, and so on and so forth, along the mission that that person and their organization had at the time. And it gave me a good overview of what health informatics was in a short period of time. Then I had this opportunity as well. Again, keep in mind that first image I showed you. I had this opportunity to go to Oxford Medical School for a medical student exchange program. And that was of my year in 2010, just before the commencement of my last year in medical school. And that was, again, another opportunity for me to see healthcare from a different perspective. I was able to see what the health system in the United Kingdom, what it looks like, and some of the opportunities therein. I was also able to see health informatics in its full form because, of course, there was electronic medical records, there was recording of appointments. There were several things that were a lot different that I could look into. Beyond that, I was able to make some contact with a professor of informatics who led the laboratory information management system at Oxford. And that person gave me a lot more confidence around what the health informatics is, what the opportunities are, as well as a link to someone who was at the University College of London, which was also trying to get students into their informatics program. I left Oxford with the intention of coming back to do a master's in health informatics at the UCL at the time that I was leaving. I fast forward to graduating from medical school. Again, sometimes you have these plans and you're so excited about this thing, but then something just makes you pause a little bit and say, what are other options that are out there? And so I started looking at different schools and the different programs that there are in health informatics, sent some emails to individuals that I've never met in my life and just, reach out to them just based on Google searches and, all of the awkward ways that I could get as much information that I can at the time. And just made sure that I was, reaching out for people's thoughts around the health informatics and the different programs. I stumbled on the program at Duke University, and I decided to do that. My decision for that was mainly because Duke has a different type of program, which included a management framework and also was at the business school at the time. And it just resonated with me because some of the problems that I've noticed in my medical studentship, as well as when I started practicing medicine in Nigeria, was that both IT and management has something to do with how we can make healthcare better or make the health system work better for the people that it serves. And so I decided on that particular program at Duke. And oh my word, that has been a huge, it's one of those life-changing moments that I continue to be appreciative, and I've always been grateful for, because it expanded my understanding of what healthcare is, some of the layers that we're not able to peel when in medical school, because a lot of focus for us has been on the clinical side of medicine, but not necessarily the management side, seeing patients as people we're there to serve, patient preferences, different things along those lines. It also opened my eyes to the different players in healthcare. Healthcare does not just revolve around clinicians. So when I say clinicians, doctors, nurses, researchers, and several other people that touch a patient when they come to the hospital, but it's also affected by the incentives that drive the type of care that is being delivered. So where does the money come from? Where does funding come from? And some of those other questions are very, very important. So understanding the payer, understanding the provider, understanding the customer or the patient within healthcare became very, I became more enlightened about the different phases and the different players within healthcare. Then I followed that up with a lot of work experiences, including practicums, internship, and co-ops. It was really nice when one of the people I did a co-op with reached out recently and was saying, wow, I'm so grateful. I'm so glad to see all of your work since the time you did your co-op with us. And that's over 10 years ago. Again, it's just amazing how things come full circle sometimes. But I've always paired that with continuous learning and participation and contribution to the informatics community, which has made things a lot easier for me. So a quick, I can't talk about health informatics even within 1 hour. It's just not possible. But I'll try to do a quick summary, just exactly, especially for those who haven't heard about it before or haven't worked in that realm before. But it's a very crucial part of the way that healthcare is evolving. I believe that Nigeria is starting to embrace some of this, but there's still a lot of opportunities for healthcare informatics and the whole informatics profession to grow and to help human health. So AIMIA is one of the professional associations of informatics in the US, and it defines health informatics or biomedical informatics as an interdisciplinary scientific field that studies and pursues the effective use of biomedical data, information, and knowledge for scientific inquiry, problem solving, and decision making. Again, motivated by efforts to improve human health. That is at the background of whatever work that is being done in informatics. That improvement of human health with what we know of the data that is collected, processed, and utilized for the purpose of improving human health. So there's a lot of it that applies the principles of computers and information science, but it's not limited to just that. It has a lot of relationship with healthcare IT. It itself is not healthcare IT, but healthcare IT is the stronghold that sort of holds informatics in place, and a lot of the data, a lot of the technicalities that comes from there is being borrowed from health IT. Health information management is another related field, because if you don't manage the information, then it becomes hard for you to even follow the provenance of the data that you're receiving and figuring out how to make it work for you. Healthcare management and leadership, like I said earlier on, is also very, very crucial. You have to be able to have the right incentives for you to be able to, or even financing, to be able to set up the infrastructure that is needed for a great healthcare informatics shop or program. I love this chat from one of my most respected person in the field of informatics. His name is Professor William Hirsch. He's a professor of biomedical informatics at OHSU. And I've had the opportunity to sort of talk with him, work with him, and it's just been amazing. Some of my training as part of my continuous learning was through some of the programs that he set up at OHSU as well, Oregon Health School, Universal Sciences University. So he has this map that sort of tells you about informatics and wraps it in a very amazing way. So informatics is about people, information, and technology, bringing all of that together. But informatics could be applied to chemicals, it could be applied to legal, it could be applied to business, it could be applied in different ways. But one of the ways that, again, as people who work either as clinicians or allied clinician workers, as many of you on the call, the biomedical and health informatics is the one that is our biggest area of concern, right? And so biomedical and health informatics can then be divided into bioinformatics, which is an aspect of health informatics, medical or clinical informatics, and public health informatics. And the differences that goes between all of this is that bioinformatics is more at the cellular and molecular level. So when you're thinking about things like omics, understanding genomics, understanding genetic components of organisms, studying viruses, and studying the different molecules and cells in the body. That's where bioinformatics come in. It's a huge area of healthcare at this healthcare informatics at this time. Medical or clinical informatics, which is looking at this at the person level. So when you're looking at individuals, whether it's the patients, it's the provider, and all of that, that's where medical or clinical informatics comes in. And then there is public health informatics that's looking at informatics at the level of population. So that can start going into population health and public health management. And then there's in the medical or clinical informatics, there is the clinical field informatics and the consumer health informatics, which is directly targeting, the end users of healthcare. And then there's research informatics and imaging informatics. Some of you would have heard about images being read and being, applying artificial intelligence and machine learning to images so that you can come up with results. So this is a very good way of representing what health informatics look like. AMIA also has this definitions of areas of practice that they talk about as it relates to health informatics as well. So you have clinical research informatics with a focus mainly on clinical research, translation bioinformatics that looks at more of how do you translate things from the bench to the bedside. Clinical informatics, like I said, which is looking at the person and it's in practice, public health informatics, and also consumer health informatics. So to just give an idea of the different sources of data in healthcare, there is so much data that surrounds us currently, and the rate at which evidence is growing every day is so huge. I think right now, healthcare medical evidence doubles every 72 days. So there's no one that can really keep track of that. There's so much data that is a byproduct of different interactions that happens, whether in the clinic, outside the clinic, at home, in traffic, the weather, everything affects health of individuals and people. So you can have data that's coming from payer records, government agencies, patient portals, research studies, generic databases, electronic medical records, and so on and so forth, especially wearables. I didn't want to forget to mention that. Many of you now have a wristwatch or something that measures different vitals for you that you can able to tell. And all of this information wraps up into something that can be used in healthcare to solve a lot of problems or even do a lot of predictions. I love this chart from a study in IEE, International Advanced Computing Conference, that was looking at the different applications of big data, especially in healthcare. So you have effectiveness of clinical trials, avoiding preventable deaths, better clinical decisions, fraud analysis, DNA and disease risk, detection of side effects of medications, research. There's just so many things that you can use the data to do if you can build the infrastructure that informatics provides for you. And so I'm going to walk through a few of some of my full-time roles and the different ways that I have been able to expand and grow in my informatics world. So this is me at I can't even remember which of the conference it is, because I had this period where I was traveling across different parts of the country, doing presentations around the work that we did at Prove, which is the startup that I worked at right after my master's at Duke. So we were looking at genome-wide association studies, identifying single addiction, mental health, and so on, such that we can use that to create risk scores or risk scoring systems that can help individuals get ahead of addiction and not use certain medications that can have that for them, and be able to identify what areas in their genomics can be predisposing them to different types of clinical conditions. So that's one way that I've applied informatics. The other one is in my full role at Duke. So I've included here a little snapshot of what we called it our requirements document looks like. So at Duke, I served as a bridge between core IT, so everything around like creation of databases, ETLs, all of those things that have to do with a lot of software engineering, software coding, designs, and things like that, working with them to define and translate clinical concepts. So being a physician, working in medicine, helped me a lot in being that bridge. So I am a clinician who understands IT, and I understand clinical researchers' point of view and clinicians' point of view, and a little bit, and so much about operations, again, from that management program at Duke. So I could make that translation of what is the question that a clinical researcher has, or a clinician has, or a quality improvement effort that an operations other public data sources that can be used to answer a certain question. An example of that is, there's this research that was done through CDC funding at the time. This was 2017. It was within the medicine and infectious disease unit. And one of the researchers was interested in the appropriateness of certain perioperative prophylaxis for colon surgery patients. And so we had to figure out, where do those pieces of data lie within the EHR? How do we make the association between that appropriateness? What is the outcome for each of those patients, and so on and so forth? And so we're able to look for that data and be able to provide that for that research. The second one that I highlighted here was one that I actually presented at AMIA at some, I think that was 2019. And it was around more of quality improvement. So I don't know how many nurses are in the audience, but some of you are familiar with alarms going off every single time, especially when you're in an ICU setting, and it keeps, you just keep hearing this blah, blah, blah. And a lot of that comes from the threshold at which certain vitals or certain componentry are being set at. So we did a whole study around determining what the alarms are, what their durations are, the threshold for those alarms, using all of that information, again, pulling that information from some of the devices, connecting them with the databases to know what the vitals of the patients were at the time, understanding the connection between them, deciding which thresholds should some of those vitals be set at to ensure that, we're not overburdening clinicians at the bedside with irrelevant alarms that then makes it hard for them to actually concentrate on doing their best job. And so that was one, and I can send the link to maybe the abstract or something later on, but that was another cool project that we did. Did a lot of support for data science and innovation work as well, contributed to quality improvement efforts, and helped with managing Duke's data in clinical research networks. So we had networks for asthma, we had networks that are, broad, that goes across multiple specialties. We had this tool called the Deduce. Some of you may have heard about I2B2. So there's different research networks that Duke was able to participate in, and we helped with maintaining those databases, querying those clinical databases, also for clinical research. And this is another, I also had the opportunity to work at GlaxoSmithKline. Some of you are familiar with the pharmaceutical industry. And I worked directly in medical advanced analytics and insights. If anyone told me that there was a way to apply informatics in pharma, before I left medical school, I'll probably say, what does that even mean? But again, I think this is the quality, it just shows the broadness of what can be done with an informatics experience. And for GSK, what some of the things that I did at GSK was a comprehensive insight generation that was leveraging analytics and data science methods, including NLP on real world evidence data. So data coming from the practice of medicine, including EHR data, medical voice of customers, that is usually short as MVOCs, social media listening, and market research. So we use all of that information to identify what the needs of our different customers, which could be patients, providers, payers, patient advocates, and so on are, and making sure that we're including that in our plans for research and development, as well as contributing to our medical affairs strategic planning. The work that I did at GSK was really, really valuable, especially in the COVID-19 response, just being able to understand what the structural challenges the physicians were having is, and making sure that we were responding as quickly and as relatably as possible. And it was really exciting to be able to do work at that level. Again, for each of this role, it was very crucial for me that the mission of the organization, especially the team that I'm working on as well, is very tied to what my personal mission is of improving lives of many. And I was able to make that tie, and it made that a fulfilling role for me. But then as at 2020, I think 2021, I made the decision to move from GSK, and then got a role at Optum. Again, one of the drivers for that was looking for an opportunity to do a lot more and impact more, and an opportunity to also continue on my path of learning as I continue to make impact. So at Optum, I worked within the Center for Advanced Clinical Solutions. And one of the biggest opportunity there was that there was an opportunity for us to design something to actually help clinicians get the evidence that they need at the tip of their fingers. And we built these tools based on standardized way of creating computable knowledge. So I have this diagram here that is showing sort of what evidence-based medicine is, and where it comes from. So there is the research, payer, and public health surveillance that talks about what is happening and why it's happening, and so on. And we were able to use that to create applications that can help to create deterministic clinical guidelines in a way that is computable and that can help with clinical decision-making. The other step on top of that was realized at the beginning of this year was combining that with AI ML for even more personalized clinical decision-making. I don't know if I'll try and play this video later on because I see that we're running out of time. So I want to leave some time for questions at the end. But there is a video here that shows you how the tool that is highlighted here that we published in JAMA, how that works and how it's supporting providers today. So in summary, again, born, raised in Lagos Medical School, University of Lagos. clinical informatics degree from Duke Health. My three things are education, health, and equity. Love to travel, explore natural spaces. I love the game of chess. You can find me doing that. Favorite vacation spot is Hawaii so far. I do a lot of volunteering outside of work. So in the area of STEAM, like Tonya was saying earlier, and, you know, I do a lot of work in women's health and professional development just because of some of the nuances and disparities that exist currently. If you're a woman in the audience, again, so many roadblocks we need to overcome, but you can create a very successful work experience for yourself in the area that you are currently, or if you decide to join me in the field of informatics. I included a few other things around the range, education, but I think everyone's path in informatics is a lot different. So there are several ways that you can improve your knowledge, whether as an informaticist or someone who is going to leverage informatics in the different roles that they play. This is the book that Dr. Onyeka talked about at the beginning of the conversation. I'm so excited. I'm so glad that that's available. And I'm in the works, so probably done, that it's going to be in the College of Medicine, University of Lagos library, so that some of the students can benefit from that. There's also a PDF version that you can get. There's just so much that informatics has to offer, and there's almost always a running track of different programs and projects that you can do, and you can find some of this on my LinkedIn page as well. But again, you know, mission-driven, purposeful, alignment of personal and organizational mission, evolution of mission, and refinement of your career path. Be courageous, adapt, and continue to grow. Healthcare is always evolving, and informatics is going to play a central role. You don't have to be a specialist, but you can learn a lot more about it so you can facilitate how you work with health informatics professionals close to you. Thank you so much for listening, and I guess it's Q&A time.
Thank you so much. Thank you. I like that you're saying healthcare is evolving and informatics will play a central role. Yes, informatics will play a key role. Thank you so much for Dr. Bilkis. I'd like to introduce the Director for the Center for Translation and Implementation Research, Professor Echezona Ezanure. Prof, please go ahead and speak to us. Thank you.
Thank you so much. Thank you, Bilkis. Thank you so much, Dr. Oladimeji. I'm one of those who recognized quite early what bioinformatics meant. And she will remember that because once I had an opportunity to establish a Center for Global Health, first person I reached out to was her. I knew my weakness, which, this computer thing up till now still confuses the heck out of me. You can imagine that my daughters get their cell phone and they give me the old one because they think I can operate the new one. So you can see that's where I am in technology. But one of the things is to find the ones who have those expertise and make sure that you know your own weakness so that you can find people who that weakness is their strength. One of the things that Dr. Oladimeji had mentioned that is very interesting to me is, and I wanted to ask you this as part of our beginning Q&A, is really to say, when I left medical school, all that was left for me was to pick one of the clinical subspecialty to do. So I ended up becoming a pediatrician. Now I have kids in medical school. I tell them, if you finish medical school and you don't want to do clinical medicine, you will not disappoint me. And what I told them that, they said, so what do you mean? I'm going to go to medical school and finish and I'm not going to use it. I said, well, that's a mistake I made, thinking that the only way you use your medical knowledge is to see patients. And she has shown you how medical informatics actually control a lot of the things you do to see patients. So there is a lot of things. And I have friends today who are in finance and working with designing MRI sound machines and different things in medicine. And so the medical knowledge is a means, not an end. At this time, like most people, you will get a mixture of people in our audience. You will get people who are fresh out of medical school, beginning their career, but also you get people who are at a stage in their life and they're trying to say, what else can excite me? So they've done 10 years, 15 years in clinical medicine. And this is one of the things I found very interesting in medicine is that you can at one time say, you know, I'm a doctor, I've done 10 years of clinical medicine, I'm going to switch and do research like me. So I don't spend a lot of time on the same patient, I spend more time on research. Or you can say, you know what, I have always loved computer, they interest me, and I do like to code. So what do you think? Is there a special time people can pivot, or is there a time that is too late for people to pivot to bioinformatics?
Thank you so much for that. And I think that is one of the reasons why I say my journey, which is different and can look totally different from someone else's journey. And the reason why I put that quote around clock and compass. So again, if you're driven by mission, it doesn't matter what time you wake up and you decide that here is the path, as long as it's still aligned with what your purpose is and what you want to accomplish. And a lot of us, I think we can unite on, we want to make the world a better place. We want to make sure that, people get the best quality care that they can at any point in time. We want to impact lives in positive ways. So it doesn't really matter. As long as you have that compass, as long as you have that purpose of what you're trying to do, I don't think there is any late time for a rebirth in a different direction to help you get to that feeling of fulfillment. Especially right now, and I think it's across the world, a lot of physicians are feeling the brunt of clinical practice because it's not, there's a lot of burnout in the system, there's a lot of stress and everything. This can be a way for you to add one more layer to yourself. I know a lot of informaticists that actually continue to practice medicine as well, which is another way to think about this journey. So you can have that knowledge and specified to practice medicine. I usually would lean more towards that because I know that the healthcare shortage is going, healthcare provider shortage is a lot. But to your question, it doesn't matter the time if you transition can look like. I hope that answers your question. And I put, again, I went back and see there's several ways to learn about informatics. You can do it through books. There's online courses, some of them even free. YouTube now is like the zone of education if you know how to search. The certification, several things who does informatics, and the sky is just the beginning, like they say.
Thank you so much. Thank you.
Thank you. Thank you. You have two questions for now. Okay. So the first says, why the switch from medical practice to information war?
To hear the long story or the short story? I'm gonna save the long story for another time. So while practicing and while being a medical student and practicing medicine in Nigeria, like I said earlier, I had this period, number one, okay, maybe the first thing to curiosity, because I wanted to know what else is out there. I'm like Moana, I want to go across and see what else is out there based on that information that I got from that event. But more so, I have a personal story of my own health not being managed appropriately at a renowned tertiary institution in Nigeria. And I almost died out of a complication, appendicitis. And it was pretty much like it was like film trick that, and it just added a lot more reason for me to want to do something better for the health system. I'm one of those house, during house job, you'd carry gloves from one ward, pick bottles for your for your test from another ward, and then walk to the patient. You know what to do to the patient. Patient does not have money for medication. All of those things were really traumatizing for me. And as much as I love clinical medicine and I still miss clinical medicine today, I just, I just felt like there has to be a better way and another way that I can continue to impact care without re-traumatizing myself in the way that, happened when I was used to practice and also dotics to help improve the system.
Okay. So the last question here says, which level of course in informatics, what level of informatics would you recommend for us, well, for that individual who has a bachelor's degree in palliative medicine?
So for someone who has a bachelor's degree in palliative medicine, I think again, this would vary. It depends on who you are. What are your goals? What do you want to do? What setting are you in? How close are you to certain institutions? Are you able to sort of dabble into informatics first through some of these online courses to just get a sense and prepare your mind for what you're going to do? There's a technical informatics aspect, there's a clinical informatics aspect that you need to be clear on, and understanding which ones in what area do you want to play. There's a part of informatics that is very technical that requires you knowing how to program. So when I was talking about querying databases earlier on, there's SQL queries and so on that you need to know. There's also SQL, FHIR, API standards. If you're someone that is leaning towards technology, there's just different areas. And again, happy to chat with people to the best of my ability. I know I don't have so much time in the world or limited time in the world, but one of the things that I love doing is guiding people through that decision. But I think from your bachelor's, after working for some time and, dabbling into this with your toes and just getting a feel for it from free courses that might be available to you, then you can think of a master's program, for instance. And in your decision of a master's program, like I said earlier, if you're more of the technical, love computer, love programming person, you can do a Master's of Science, which is an MSc in informatics. And that would help you get on the path that, gets you started on the journey around creating tools, whether in bioinformatics or several other aspects of informatics. If you're not very technical, you might want to do more of the management and clinical informatics. So the MFCI that you see at the back of my designation is that combination of clinical, business, as well as technical. But the technical side is left for you to, dive in different directions that you have, unlike the MSCs that would focus very deeply on that technical aspect. I hope that helps that person, but feel free to send me a message or something.
I think so. So the last question here is, someone is saying, how can one access your ebook?
Oh, so it's for purchase. So it's not free online. So you'd have to look for it, and a Google search should be able to help you find it. But you can buy the PDF version, or you can order the hard copy. And like I said, I'm working with one of my colleagues to get at least 2 of the books in. If you're if you're in the medical school in Lagos, you might be able to have access to it at the library coming soon.
So I will get one of the copies. I will buy one of the copies for those at Enugu. So
there you go.
be a copy. So if you do want a copy of it and you live in Enugu,
we're happy.
You will have that.
Good. That would be
Thank
that would
you.
be awesome. Yeah.
Okay, so the last question here says, from Nancy says, oh, okay, so a few more. Did you have to learn coding or data analysis?
Yes. I had to learn coding, and it's interesting. SQL, I knew I was going to need anyway, so I learned that actually before leaving Nigeria for my master's. So I was doing NYSC, and I had a few more time on my hand, and I got this private tutor to just teach me, and I was combining that with what I could find online about SQL querying. So SQL is used to query databases and helps you to sort of dive into using different statements to gather or connect data from a relational database. I learned that. And then I also took some courses in analytics that exposed me to different tools. Philip's thing that I was showing you earlier, this alarms data thing, I actually created some of these dashboards. I created most of these dashboards by myself using Tableau. So visualization and all of that, you need to learn some of the tools to do that. Data science tools as well, I had to learn some of them. I try to avoid coding where I can sometimes, because again, that's not my strongest suit. And as I've progressed over time, there's a lot less coding that I have to do and a lot more management and leadership things that I do more today. So I usually would lead analysts, informaticists, and so on, and guide them through the strategy of doing the work of the technical part.
Thank you so much. So thank you so much, Dr. Bilkis Oladimeji. Thank you for this wonderful insight into your journey in clinical medicine down to health informatics. You stirred up a lot of people, their interest. People are busy, private chatting me, your book, your email. So I think you have a fan club. You now have a big fan club here.
Thank you.
We will want you back. We're proud to say, of course, you're a member of the Center for Translation and Implementation Research.
Yes, and so, if you will, I can say, one of the things that I've tried to do, even though I'm based in the US, is continue to see ways that I can continue to help however I can, whether through volunteering. I did that with Ebola Alert and some of the work around Ebola. CTAIR is another way of just continuing to stay grounded within the healthcare and research community within Nigeria to ensure that I continue to do as best as I can give back. So thank you so much for this platform and giving me the opportunity to speak with everyone.
Thank you.
Thank you. I think one of the things that we hope that will happen, and we're still hoping that Bilkis will continue to engage with us, is that we currently do have a in something that started from project management, take the course, take the certification, become project managers. Then they're going on to become research coordinators to be able to implement those research. They have had opportunity to train in grant management. And one of the things ultimately is I want them to be our bioinformatics in those 12 areas. So not everybody need to get a PhD and implement and bioinformatics to become a bioinformatics person. And what I do think is that there are transferable skills who do biostatistics, who already do data analysis, to be able to say, if I do data analysis, what other components can I include? So one of the things I want to be able to remember, and this is what I found out in the US, I always tell people, they say, well, why don't you have a PhD? I say, what do I need a PhD for? And the question that it there is that I thought about it. So it's not a didn't, but I asked the person the question to realize it. But what I realized in the US is that you, in that PhD, you are given a course that you have to complete. But if you already have a terminal degree, you don't have to, you can select specific things you want from each area. So you can go to coding and take a certificate course in the area that you want. And then you can get a mentoring in that area, which will do you better than even getting courses that you go in there. They say, oh, you have to get epidemiology, basic epidemiology, 3 credits. You're a doctor who did public health. What the heck do you need 3 public health? All I'm saying is your objective and your pathway, without which is by people like Bilkis, people that have been opportunity to take specific certificate course, specific courses. Dr. Bilkis, am I wrong in saying that those things are available?
You are absolutely right. And a lot of times the schools won't be able to sit down with you and say, oh, you've done epidemiology, oh, you've done medical statistics, oh, you've done this. You'll just end up doing pretty much the same thing all over again, just in search of a terminal degree that doesn't really add so much more to you. So again, it depends on each individual and what level of education you already have. Again, information is so ubiquitous now that you can find some people don't even go, they don't finish college these days when they get into programming, and they're doing really fine in software development and things like that. But as a clinician or someone who has worked as an allied healthcare person, you actually bring in a huge, you bring in this huge bridge of knowledge of clinical medicine that you're bringing along with you, that when coupled with programming, when coupled with essentials of informatics, there's several courses. So I know I mentioned site, MSS. Find a lot of introductory healthcare IT, healthcare informatics program that you can take a look at. But to the point that you're making, Prof, I think actually getting into a practice in it helps you be better at informatics than any other amount of knowledge that you're trying to bring together. So any opportunity to learn from someone else, to do an internship, to do a practicum, to learn and then translate that knowledge into application would serve you a lot more. And there's several online resources, open source resources. If you look at CDS Connect is another thing you can take a look at. They already have a few of those programs already for clinical decision support that you can plug and play. And you just find so many things out there that you will be able to practice some of these clinical informatics things on. And like I said earlier, there are different types of occupation that falls under the breadth or umbrella of informatics. It could be technical, it could be clinical, it could be administrative, consulting, and so on. And just knowing which one or which direction you want to go can help you figure out what type of learning you need to do without even an additional degree to get to those positions.
Remember that this presentation is available on our YouTube site, and so is many other ones that we'll bring to you every month. The reason I just wanted to say this, that this is our cap for 2023. This is our last monthly webinar that is open, and we reserve that for our different pathway in medicine. So every month we bring you a special guest. And this, of course, we make this available to every part of Nigeria. And you can see some people in other parts of Africa has been joining us over the period.
Thank you.
And the good thing about it is that they are free, courtesy of the people who take 1 hour of their time to speak to us without asking for fees. So you have to remember that it's 1 hour of her time. I know how much she makes in an hour on average of that, but she's allowing that 1 hour to spend with us. So we are very grateful as we add to then, and we will start back in January, and every month we will bring you a special person and a special topic. And by the end of 2024, we will bring you another pathway in medicine for you to see that Dr. Belkis mentioned. And also on the site, you also see our CTR email. One of the things that we also do have that at the University of Nigeria that you want to remember is that we do have some training on basic bioinformatics. Our informatics and the IT lead, who is a computer scientist, Jude, who really put this together, put it on the website for you, put it on the YouTube for you, and try to make sure that these conferences go very well. This is one of those things I say people can still mentor you. There are certain courses you can scale. So you're not just having a certificate, but you're actually acquiring skills, and you can start with those. And if you think, okay, oh, this is really interesting for me, then make the big dive of course, becoming a professor in bioinformatics. There's nothing wrong with that. But you can start small to say, is this for me? Does this align with what I want to do? Do I enjoy doing this? Again, what I always say is that most of you already here have a career, so you're already maybe in healthcare, but there are so many different ways you can use that skill. That is not more than one. Don't think you are confined to one of them. It took me a while to realize that, you know what, I can make as much money from research as I make from seeing patient. Right. So people say, well, but it's not about, I didn't make more money, but I made as much, which means I can shift and do something else that I like to do. So I dropped my clinical service from 100% to 25% and spend 75% of my time in research. Again, if you find something, that is one way you can do it. Like how Billy said, we need doctors, we need nurses, we need healthcare people. So don't quit completely if you can. Leave the 25% so you can continue to contribute. And then that skill set can also help you in other ways. Thank you all so much for attending, and we love you. And if you have a chance, go to the YouTube, watch it again, like us there, or go to LinkedIn and then tell us that we're doing some good. It gives us a little bit of feedback to know that what we're doing is valued and that we should continue to do that. Thank you, Dr. Blakis, for being with us.
Thank you so much.
Thank you. Thank you, Prof. Thank you, Dr. Bilkis. So thank you, everyone, for staying on up to now. We're going to have a break in January. See you in February with our next webinar, and have a fantastic December. Have a fantastic Christmas and a great New Year. So see you in the New Year. Bye-bye.
Thank you.